So what is the role of pharmacist? So the role of pharmacist includes compounds and dispenses drugs. So the pharmacist should compounds and dispense drugs. Again, gathers information about patients. Also, a pharmacist counsels on possible side effects and adverse reactions. Again, monitors of drug interactions. Again, screens, monitors, and advices for self-treatment with over-the-counter products sold without prescription. Provides drug information to other healthcare professionals. Advices on home healthcare supplies and medical equipment. Plan and implement effective drug therapy. Monitor and evaluate drug therapy for improved outcomes. Evaluate clinical literature. Selects appropriate dosage form. Calculate dose and determine dosing schedules. Educate and counsel patients. Coordinate patients' care with other healthcare providers. So, types of pharmacy practice areas have community pharmacy, hospital pharmacy, industrial pharmacy, clinical pharmacy, compounding pharmacy, consultant pharmacy, internet pharmacy, veterinary pharmacy, nuclear pharmacy, military pharmacy, and pharmacy informatics. So let's start with community pharmacy. So community pharmacists are the health professionals most accessible to the public because they are in direct contact with the public. They supply medicines in accordance with a prescription or when legally permitted, sell them without a prescription. For example, OTC products or over-the-counter products. In addition to ensuring an accurate supply of appropriate products, their professional activities also cover counseling of patients at the time of dispensing, giving the patients advices, regarding their medication. And these advices are given on prescription and non-prescription drugs. Also, they provide drug information to health professionals, patients, and general publics. And they participate in health promotion programs. They maintain links with other health professionals in primary health care. So, the main activities of community pharmacists include processing of prescription. So the pharmacist verifies the legality, safety, and appropriateness of the prescription order, checks the patient medication record before dispensing the prescription, when such records are kept in the pharmacy. Ensures that the quantities of medications are dispensed accurately, and decides whether the medication should be handed to the patient with appropriate counseling by a pharmacist. Second job or activity is care of patients or clinical pharmacy. So the pharmacist seeks to collect and integrate information about the patient drug history, clarifies the patient's understanding of the intended dosage regimen and method of administration, and advises the patient of drug-related precautions, and in some countries monitors and evaluates the therapeutic response. Again, monitoring. So the pharmacist also should monitor drug utilization. So the pharmacist can participate in arrangements for monitoring the utilization of drugs, such as practice research projects and schemes to analyze prescriptions for monitoring of adverse drug reactions. So extemporaneous preparations and small-scale manufacture of medicines. So pharmacists everywhere continue to prepare medicines in the pharmacy. This enables them to adapt the formulation of medicine to the needs of the individual patients. So he has to make the quantities of medications that is required by the patient. Or he can, for example, the patient require a special dosage form. He cannot take pills or tablets or capsules, so you need to make for him a liquid preparation. This is done through extemporaneous preparations. Again, the fifth activity is informing healthcare professionals and public. So pharmacists can compile and maintain information on all medicines, and particularly on new introduced medicines, provide this information as necessary to other healthcare professionals and to patients, and use it in promoting the rational use of drugs by providing advice, explanation to physicians and to members of public. Also, the pharmacist's role has a role in health promotion. Pharmacists can take part in health promotion campaigns locally and nationally on a wide range of health-related topics, particularly on drug-related topics: rational use of drugs, alcohol abuse, tobacco abuse, discouragement of drug use during pregnancy, organic solvent abuse, poison prevention, or topics concerned with other health problems like diarrheal disease, tuberculosis, leprosy, HIV infection, and family planning. They may also take part in education of local community groups in health promotion and in campaigns on disease prevention, such as expanded programs on immunization, malaria, and blindness programs. So hospital pharmacy. So hospital pharmacies can usually be found within the premises of hospital. So hospital pharmacies usually stock a large range of medications, including more specialized and investigational medications, medicines that are being studied but have not yet been approved, than would be feasible in the community setting. So we will find a lot of medications available in the hospital, more than that found in the community settings. Means that you can find a lot of medications, even investigational medications, that is new medications which are not yet approved. You can find them in at the hospitals, while you cannot find such type of medicines at the pharmacy. Hospital pharmacies typically provide medications for hospitalized patients only and are not retail establishment. So industrial pharmacy or pharmaceutical industry, it includes manufacturing, development, marketing, and distribution of drug products, including quality assurance of these activities. So They include research and development, manufacturing and quality assurance, drug information. The pharmacist has the knowledge and expertise to provide detailed information on medicines to members of health professions and public, patent applications and drug registration. The pharmacist is ideally qualified to understand and collect the diverse information required for patent and authorization submissions, clinical trials, and post-marketing surveillance. Clinical trials and post-marketing surveillance, sales and marketing. So this is as far as industrial pharmacies activities, which starts by research and development, manufacturing, and drug information, and the patent application and registrations, and clinical trials and post-marketing surveillance, and finally sales and marketing.